Sometimes I see patients, people, they eat anything, they work anything, they sleep. I tell some patients, why don't you ask these things 10 years back? You should have asked these things when you were in student life.
Do you think yoga and meditation help?
We think that there is a higher force which is controlling us.
Do you think sleep pattern affects?
So what we suggest, minimum, once mind is agitated, various bad hormones, sleeping heart rate itself is 100. That means there is something wrong in the heart. Sleep is very important because not only it gives the physical muscles rest, it gives rest to all the organs. Besides mind gets rest, no doubt, but the brain, heart, kidney, liver, every organ gets rest. They go into a slow phase, like a sleeping mode in the computer and all.
Sir, once the patient underwent a bypass surgery, so what are the precautions he has to take after the bypass surgery?
Yeah, this is a very interesting question we sometimes face in our OPD, and sometimes I introspect and analyze. We, as a public or human beings, we start changing our lifestyle once something happens.
Yes.
So before that, if we start, then all these things we can avoid. That should be our motto.
Yes, yes.
Like when we are traveling on the road, after accident, you try correcting. It is not a ideal thing or desired thing. Similarly, if a patient gets heart attack or arteries are clogged or narrowed, that time everybody gets conscious how to manage the lifestyle, what to eat, how to sit, how to bend, where to sleep, which side to sleep. But before that, nobody bothers.
Yes.
So that is where we have to develop a public awareness, and the healthy people should come to learn those things. That is where it is required.
Yes.
Because sometimes I see patients, people, they eat anything, they work anything, they sleep whatever the way they like. But after surgery, they will come. What are the things we should eat? Whether we should eat banana or not, whether we should eat brinjal or not, potato or not, everything they want a detailed thing. So I tell some patients, why don't you ask these things 10 years back? You should have asked these things when you were in student life. But why we are asking now? So that's how we should educate the people. But as I told, we should have a healthy lifestyle, not only in our daily routine activities, like how we should do exercise, how we should make our life comfortable, and whatever the unhealthy things we do or practice, those things should be avoided from the very childhood, I must tell. Because what we are telling, the plaque formation, it starts from childhood. It is not that somebody develops after 40 years.
Okay.
So in that area, if we make it unhealthy because of our lifestyle, that becomes a nidus, or the point where these cholesterol gets deposited. So coming to the lifestyle things, first most important is we should avoid a sedentary lifestyle. We should have some sort of exercise, yoga, and we should have a routine work. Just nowadays, this work from home has come. People are very lethargic. They will be sleeping on bed and working. Those things has to be avoided. We should be fit enough to do the things. We should do some work. Minimum some walking has to be there, and as advised, minimum 10,000 steps. But at least 5,000 steps people should walk per day, whether in the workplace or morning, those things. Suppose somebody goes in a executive work, they don't have to walk. When they go to office, they have to sit and do their work. They must walk in the morning. They must do some exercise and go to the office. Otherwise, if they wake up at 9 o'clock, get up, get ready, go and sit in the office, then come back, eat and sleep, that will be a sedentary lifestyle will be considered. Okay. If they have to sit in the office, they have to walk, go to the office. But those who are daily laborers, somebody is going to farm, they should not go for a morning walk. Those things has to be educated to the people. Similarly, food. Food is very important part for us. We should have a healthy food. And I can proudly tell that the Indian food, what we are taking 30, 40 years back, what we are taking in the village time, those are very important. We should take that. we should not westernize ourselves into the food thing. And whatever somebody advertises, we should not follow, because somebody advertising for some food, that means they want to do business.
Yes.
Nobody will advertise to take ragi. People will advertise to take McDonald's
Yes.
food. So those are things we should think. Nobody will advertise to take coconut water, but they will advertise to take Coca-Cola.
Yes.
So those are things we should avoid in our daily thing. Okay, once a while, if somebody takes, you should not religiously follow that, but that should not be our routine thing. Because I have seen people, they will have cold drinks must in their lunch time, dinner time. Those are the very dangerous things. I must tell that people should understand cold drinks is more dangerous than taking alcohol. It's such a dangerous drinks we are taking, and we are thinking this is good.
Yes.
Sometimes fruit juice, sometimes you take fruit. Why you take fruit juice? If you go to a fruit juice shop, he adds a lot of sugar in that. The fruit's quantity is less than the sugar.
Yes.
And we literally we are eating, taking sugar there, which is again dangerous for the body. So similarly, we can have various discussions on that, but we should develop a healthy food for us.
Yes.
And the other important thing about food is, I can tell to quote from Gita. If everything is written there in our scriptures. In Gita, one place Sri Krishna has told, we should not overeat or should not less eat. If we eat less, again it is not good for body. But if we eat more, then also it is not good for body. You should have a balanced food. And the other important thing is, there are various foods. They are classified into three categories: tamasic food, rajasic food, sattvic food, and accordingly we should take. And because that changes our behavior. If you take tamasic food, you will become sedentary.
Yes.
If you take sattvic food, you will be very spiritualized, content, composed. That makes, if when we are in that affects our body system. That is where we should go. If you take very rajasic foods, rajasic foods are like very spicy foods, non-veg foods. Daily we eat non-veg foods, spicy foods. We will be very desirous. We will be running after various unhealthy things. We will be doing all the nonsense things which is not required in our daily life. So those things originates from food. We should understand that.
Okay.
And we have to spend some time in spirituality, so that our ego, ignorance, all those things can be neutralized. And those are very important, not only in our spiritual journey or our humanity journey, but in our healthy lifestyle, which is helpful for our body.
Somewhere I have seen this one. If your mental condition and you are always in the anger, or you are always in a condition where you will be disturbed always, so you will be facing lot of problem of your health issues. Your health is against,
So
they
what
work
happens?
against you,
Yes.
against your body.
So this any stress and strain, that there are various bad hormones in the body they release.
Yes.
And most important is adrenaline. And there are various dangerous system the body enters into, and those things makes the vascular bed inflamed.
Okay.
And that is the bad thing. What happens if we are calm, composed, contented, then this will not. If we become too greedy, every day we want to earn a certain amount of money, whether you need or not, then we will be getting into very unhealthy practices. Unhealthy, we will become jealous to somebody.
Yes.
And we do something which is not required. So all these things indirectly or directly affects our body, that we have to understand whether that is needed to make this body unhealthy. So if we come out of that, definitely this inflamed state will be prevented. If we prevent the inflamed state of the vascular system, then the vascular tree will remain good, then these things will not come. And coming to other strains, stress, like somebody near and dear, somebody lose, particularly widows, we have seen, if somebody has lost her husband, immediately they become more sick. And those patients, even they develop coronary artery, they come for surgery, their outcome also sometimes becomes bad, because that stress it is continuing.
Okay.
And sometimes some people get stressed because of their children not doing well. Somebody's children, they have become drug addicted, drunken, they are not doing job, they are spending what these people have earned. Those also put stress on them, and by that they develop heart attack. You might have seen many people during the marriage of their children, they get heart attack because there will be financial stress for them, or their children may be marrying somewhere which they don't want, or there will be some issues, family issues going. So those things also precipitate these heart attacks.
Okay.
That is precisely happening. That creates again a very inflamed vascular state in our vascular system, and there they develop. So some people I have seen their coronary artery angiogram they have done 2 years back normal. Now they have developed 70-80% disease. How it happened? So
Okay.
these two years they might have gone various stress and strain. Unlikely their food system might have changed because we don't change our food habits so frequently, but definitely some stress and strain has created a very unhealthy system where this cholesterol deposited and they get blocked.
Sir, before surgery, you told that the precaution has to take like stress relief and your exercises, food, so many things you have told. Sir, do you think yoga and meditation helps?
Yes, yoga and meditation has tremendous effect.
How?
In fact, I can tell it is more important than surgery, stenting, or medicine.
Okay.
But it has to be started from the beginning.
Okay.
It's not that today somebody develop cardiac disease and he starts doing yoga today and tomorrow it will be okay. No, that has not there. What we tell, yoga should be the way of life, as Sri Aurobindo has told. It should be the way of life. It is not something different.
Okay.
The Indian system, the Indian culture has taught already these things to us, that yoga should be there. Yoga means not just doing some gymnastic way of asanas or making head down and leg up. That is one part. That is asanas, what we tell. But yoga is the what Patanjali has told us, Ashtanga yoga. We have to purify your mind first. We have to be, there are various systems we have to follow, and once we follow those things, then we can fit to do the yoga. Then asanas, pranayams, we have to reject some of the bad things. Then we start meditation, pranayam, then we go into deeper and deeper stages. But these external things we have to do very in our day-to-day life. Otherwise, it is very difficult to maintain the things. And once we do these things, go to temple or church or whatever people believe, we think that there is a higher force which is controlling us. If all these things are there, our mind slowly will become silent, and we will be rejecting some of the unhealthy thoughts, unhealthy habits, unhealthy food style. Slowly we will be stopping. Like some of the puja days, we don't take non-vegetarian.
Yes.
Nobody will take, particularly in Hindu thing, nobody will take, say, non-veg thing on Ratha Jatra. But next day we start taking. Then what is fun of doing that? Because body does not know today is Ratha Jatra or Shivaratri or Amavasya. Body, whatever goes inside, it does. So on the festivals, what we have taught to us ourselves is, this is a practice. One day we are living. So similarly, all those things has to be started in daily basis. If we are not doing 365 days, at least try to do 50% of the days, 75% of the 80% of the days, depending upon our mental state. That is how things should go.
Sir, do you think sleep pattern affects heart disease, or what kind of how many hours a person should go for sleep? Or tell me something about the sleep.
Yes,
how it affects.
sleep is also as a very important part in the lifestyle management, and nowadays everybody is using mobile. Like mobile, sometimes they get hang, they get something not coming, WhatsApp not opening, mail not opening. If you switch off the phone, restart, again it comes to normal. So similarly, in our day-to-day lifestyle, we start our day with the morning, then some family issues will come, some workplace issues will come, some financial issues will come. So our mind, body, they get clogged with various thought processes, various issues what we felt. So even if we are sitting, physically we are not tired. By mental we get tired by the end of the day. So unless we have a proper sleep, then next day we will not be fit to work again. The mind will not be fit to do the things. So what we suggest, minimum 7 hours one should sleep in the day, in a particular day. But if you don't sleep 7 hours, next day will be, you will be sleep debt. Suppose today we sleep 5 hours, that means 2 hours you are debt. So that has to be compensated at least by next day, and whole week's debt has to be completed by the end of week, Sunday to Sunday. From Monday if you start, by Saturday every day if you have sleep debt of say 30 minutes, 1 hour, someday 2 hours, by that day you should completely stop. It should not go to next week. Ideally it should not go to the next day. 24 hours you should complete 7 hours. If for some reason, or you are traveling or something, or some function, something happen, next day you should do it. Or if it is going slow, some 30 minutes, 40 minutes, by the weekend you should stop.
Okay.
We if required, we should take 1 day leave from the work and sleep if it is required. That much required the sleep for the body, particularly.
So how
physically.
sleep affects the heart issues?
It is again the when we don't sleep properly, our mind remains agitated. Once mind is agitated, various bad hormones within the body they start releasing.
Okay.
And those things affect the various organs. So
Okay.
if we sleep properly, we can see ourselves. If we have a 7 hours good sleep, the day is different. If we have a disturbed sleep, if we sleep at 2 o'clock night, you get up at morning 6 o'clock. The next day, our work efficiency, our mental status, our decision making, definitely it will get affected.
Yes.
And that is how it is important. But people, because of various nature, greedy, jealousy, or something, we want to supersede somebody, we forget to take sleep. But in that way, we are harming ourselves than the other people.
Yes.
So sleep is very important. Whatever be that much sleep, whatever our work we are getting, whatever we are earning, whatever things we are getting, we can think it is as a grace of God, and we should accept that instead of compromising the sleep and making our body unhealthy.
And people still the audience who will see this episode, they will also take, if they'll go for more time, more hours of sleep, like 8 hours, 10 hours, that will also affect our body.
Yes, it's ideally 7 hours, but
Okay.
more the sleep, it is not good. That is again we are going to the tamasic stage.
Yes.
If you sleep more than 8 hours, again the body system gets destabilized.
Okay.
Because we have to work. The all organs also has to work.
Yes.
When we sleep, it is not the physical body which is sleeping. All organs go to a slow phase. What we can see, though heart is beating.
Yes.
If what we see, suppose in ICUs we see the patient when they are awake in the daytime, suppose their heart rate is 90, 100. When they are deep sleep, we see in the monitor, their heart rate will be 60s.
60s.
That's why we take a parameter, what we call a sleeping heart rate. If somebody's sleeping heart rate is around 50 to 60, he is healthy. If a person's sleeping heart rate itself is 100, that means there is something wrong in the heart. It has not become normal. So that's how we assess in the ICU patients.
Okay.
So in waking state, if somebody's heart rate is 100, 120 like that, that means their heart is not good.
Not good.
So sleep is very important, because not only it gives the physical muscles rest, it gives rest to all the organs. Besides mind gets rest, no doubt, but the brain, heart, kidney, liver, every organ gets rest. They go into a like slow phase, like, or what we call like a sleeping mode in the computer and all. So they also just take rest. Then next day they start in a better way.
Yes.
That's why we go for morning walk or morning exercise, because heart has taken proper rest. If you give little strain also, it will work in a better way.
Okay. Okay. Sir, after surgery, are there any kind of certain activities or habits that should be totally avoided after surgery?
Yeah, after surgery, what we advise patients is first is they should have a healthy lifestyle, as all these discussed, proper sleep,
Yes.
avoid stress and strain, and clinically more important is control of the blood sugar. If after surgery also their sugars are high, uncontrolled blood sugar, they take sweets, this, that high, and it does not get controlled, again it will affect the heart.
Okay.
Sugar control is very important, blood pressure control, lipid control is very important, and they have to have a strict adherence to the drugs. What the medicines, what we tell, medications, they have to take properly, timely. They should not think that operation done, I am all right, I don't want to take medicines. Then again, if they don't take medicines, again it will affect the heart.
Yes.
If they don't take diet properly, that will affect the heart. Sometimes some people ask, sir, मेरा तो bypass surgery हो गया, now I will take whatever I want. That should not be. Because bypass surgery done, again you have to keep the heart here. There is disease still inside the heart.
Okay.
These blocks are still there, we have bypassed it. It can develop another block somewhere. Okay. So they have to maintain the lifestyle properly. And they should not think that, okay, bypass surgery done, if we'll enjoy our life, again something, again we go for surgery. That should not be the aim of the people, because again doing a surgery or stent or whatever, again it is affects the patient's risk, because second surgery it has its own risk. And before surgery, if they develop heart attack, then they may lose their life. So strict adherence to the exercise, sleep, diet, medicines is very important. And if they can adapt yoga into their lifestyle, it is nothing like it. They should do it. I have done a study of role of yoga in post coronary artery bypass surgery, for which I was awarded PhD in yoga from Andhra University. Okay. And I have trained a lot of my patients. Even now also I tell my patients they should start yoga, and yoga should be the way of life. Then at least after now they can have a healthy lifestyle.
These are things patients should do.
Yes.
Then what are things patients should avoid, like taking alcohol?
Yes.
And
Healthy, when I am telling diet, if you take healthy diet means they should avoid other things. Yes. And more important is salt. They should restrict the normal salt. Sugar also they should, per day maximum somebody can take 5 grams. More
5
than
grams,
that, yes,
okay,
you should not take. So that is very important. And try to avoid non-veg injudiciously eating. Once a while, okay. But what I have seen, those who are taking mutton and chicken, they create a very inflamed stage in the body. So those has to be avoided, particularly the mutton, and particularly those who take beef and all. There are highly inflamed things, those who take, that makes the clogged arteries more. And the drinks, as I told, alcohol, even cold drinks, fruit juice. Yes. We think fruit juice is good. Fruit juice, you make your own fruit and juice at home, that is okay. But if you take from fruit shop, they are giving nothing but sugars. So yes, that is are very dangerous. And taking white flours like maida and all, those are also very dangerous. So those has to be avoided. And reuse of oil, like fried things, particularly those who take once a while, taking may be okay, but there are, I have seen some people every day they will take fry. Every day in their home there will be some fried item, otherwise they don't take. That is a very added risk. Okay. And sometimes what you feel, people feel, I am taking vegetarian, so I am okay. But I looked at my statistics, almost 40% of my patients who undergone coronary artery bypass surgery were vegetarians. So I looked at the thing when I was doing my research, and I found that because they think they are vegetarian, they overeat again vegetarian unhealthy diets. Like they take sweets more. They think they are vegetarian, but sweet itself is harmful. Harmful. Every day they take fried food. Without fry, they cannot take. Without more oil, they cannot take. Then it is again dangerous. Yes. So that has to be done. Whether you take veg biryani or non-veg biryani, if there is too much oil is there, that is dangerous for us. Yes. Whether somebody has taken 2 pieces or 3 pieces chicken extra, as it is dangerous, but the biryani rice itself has a lot of oil that has to be restricted. Again,
Okay.
maybe once a while it is okay, but people who are adherent every alternate day they take biryani, definitely it is harmful to the body. And we cannot make ourselves proud that I am taking vegetarian, because some of these vegetarian food lifestyle also is dangerous to the body.
Okay. So many people right now they're taking non-veg. So what's your suggestion? How in a week, how many times they should take non-veg?
I personally feel weekly once should be there.
Once.
Yeah. Or if they are very much attached to food, maybe twice they can take. And the quantity has to be very moderate. They
Okay.
should not go on eating non-veg, that is very dangerous. And of all the non-veg, maybe fish is little compatible with the human body, but other things, even egg, also sometimes dangerous.
Yes.
But it can be taken. It's not that it should be totally avoided, but in moderate, not very high.
But fish is good.
Yes.
Today we come to know so many things about heart issues, heart problems, and preventive measures, lifestyle measures.